Gynecomastia typically consists of an excess of both fat and breast tissue. Adequate treatment of gynecomastia usually requires removal of both the fat and the breast tissue. Excess fat is removed by liposuction through a small hole on the lateral aspect of the chest. Liposuction, however, does not remove most of the excess breast tissue. This excess breast tissue usually requires surgical excision. This is done through a small, U-shaped incision along the bottom of the areola. The breast tissue is then separated from the overlying skin and the underlying muscles. The breast tissue is then everted out of the chest wall. It is then removed in a meticulous, precise fashion, making sure to leave a normal amount of breast tissue behind. Removing too much will create contour irregularities. However, removing too little will not correct the problem. At this time, the skin and nipple area are then sutured back down to the underlying muscles. This encourages the skin to heal in a smooth fashion.